Well, welcome, Dr. Will Cole, to the Girlfriend Doctor Show. It's nice to have you back here.
Dr. Anna Cabeca, I'm so excited to be back. Thanks for having me.
Well, I have so much to ask you about. I follow you, of course, on social media too, and you had two really key posts just recently that I found very on point. One is about histamine intolerance, and many people don't realize this surge in the surge in histamine intolerance in midlife and perimenopause and menopause. So I definitely want to hit on that. And another one, it was basically, you're not lazy, you're burnout. And I really personally really resonated with that one.
Yeah. Oh my gosh. It's on both of those. Those are definitely, those posts, like any of the posts on Instagram specifically, they typically happen with no planning. And it's me at the end of a day of consulting patients online and typing in my notes and thinking about, well, what happened in that day. So the day I wrote the histamine intolerance was just the day that I was talking a lot about it on labs, with like going over labs and explaining to patients. So I was like, oh, I'll write a post about it. And with burnout, same thing. So there's no like significant like social media strategy. It's just me on my notes and then wanting to share with something with everybody in the on social media.
Well, and it's so important because sometimes we're experiencing these things, our clients are experiencing these things and
Yeah.
don't realize, that there's something that can be done about it, or the physiology, or we think that they're they think that they're broken, or we think, I mean, it goes on. So this client I had this week, it was I'll share with you. She's so lovely. I saw her last July when I first started practice back here in Dallas, Texas, and she'd been a beautiful lady from South America and had 5 of the pandemic, of the shots for the COVID vaccine, and she had long COVID. Long COVID, young woman, 4 years old, couldn't get out of bed, 2 young kids to take care of, and she's was prior to that fit, dancing, yoga, exercise, and here she found it hard to even walk to the kitchen in her home. So
Mhm.
recovered her from long COVID, through like over 3 to 6 months, completely reversed the process. But then in this fall, and she's always struggled with allergies, but this, fall, she really started having these exacerbated, histamine intolerance symptoms, and now she's almost 46, so this perimenopausal time period, and working with hormones and the effect of estrogen. So I'd love to discuss that, and, an approach your I would love to learn your approach to
Yeah.
helping.
Yeah. Well, look, it's our approach in functional medicine, for people that don't know, it's that asking the question, well, why is the problem there in the first place? And what's driving histamine intolerance in one person may not be driving it in the next person. So that's where our health history and context and labs will get to what's the upstream variable that's driving that. Because as you know, but for people that don't know, histamines are a normal part of the immune system. There's nothing bad about histamines. They're chemical like, mediators. They're released by mast cells. And it's when you have histamine intolerance or an accumulation of histamines, it exists on a spectrum. I mean, there's mild cases, there's intermittent variable cases, all the way to mast cell activation syndrome or MCAS. So there's a whole continuum of dysregulation of the really the neuroimmunoendocrine axis, this intersection between the nervous system, the immune system, and the endocrine system, which you talk so eloquently about. And the way that these systems are modulating influences the other one. They're all interconnected. So I it's the studies around COVID, and we've seen it prior to the pandemic. We saw it with things like Epstein-Barr virus and other viruses could trigger it. But certainly this novel virus of COVID-19, there's a certain percentage now, the studies are showing this, that it triggers some sort of inflammatory response. For some people, it triggers an autoimmune response. For some people, like a specific type of autoimmune response is POTS, postural orthostatic tachycardia syndrome, which histamine intolerance can be part of that, certainly with people. So it is definitely to recover and to help to support the healing of somebody with long COVID, with POTS, some dysautonomia problem. It takes time, as you know, but for some people it's not. virus, right? It's something else. So, I mean, the other areas that I see really contributing to histamine intolerance are mold toxins. I see a lot of chronic Lyme cases. I see a lot of SIBO cases, people that have SIBO in the connection with histamine intolerance. And then, as you talk so well, brilliantly about, it's when you have hormonal shifts and the way that estrogen and progesterone modulates the immune system, that can set it over the edge as well. Not to say that it's a common, but it can be the straw that broke the camel's back, right? It's not that I'm not saying that perimenopause is causing histamine intolerance, but it can be certainly be gasoline on the fire for an already tempestuous immune system. So
Mhm.
it's so unique. But the commonality is, well, A, we have to find out what's driving it, and then B, deal with what's driving it. But certainly there are ways that we can attenuate and support mast cell stabilization and or the degradate, like the breakdown of histamines as well. But these are difficult cases oftentimes. There's certainly ones that we have a lot of like success with and confidence in, but they're not like, I mean, most people that have histamine intolerance, as you know, they're already doing the basic foundational stuff, but they're still spinning their wheels. So it's definitely one that takes a lot of, I think, clinical experience that and due diligence and thoughtfulness that they deserve.
Yeah, no, I completely agree. And it's a good explanation. Again, multiple underlying causes. How do you test for it? So, how does someone know if what they're, well, first, can you go over some of the signs and symptoms of histamine
Yeah,
intolerance?
sure. So it could be things like brain fog, migraines, nasal dripping, like runny nose, sinus issues, itchy skin, diarrhea, IBS type issues, IBSD specifically. It could be IBSC as well, but I see more IBSD issues. Painful periods can be another symptom. Those are the most common ones. Now, all of those things I mentioned are non-specific. I'm not saying that just
Right.
because you have those symptoms doesn't automatically mean you have histamine intolerance, but if you've kind of the more boxes you check and you want to at least rule out it's an issue, and if you've done lots of things for those problems and you're not getting better, then narrowing down the histamine intolerance could be a possibility. Anxiety is another one too. I see people that have like inexplicable anxiety being a component to their histamine intolerance.
Yeah, no. And that concept of just itching, aggravated after certain types of foods where they get that
Oh yeah,
hives, that histaminic reaction. So low histamine diet's one part of the both diagnostic and therapeutic. What
yeah,
are some other things that can do to intervene? But definitely healing the gut. I mean, you're expert. I loved our interview, and I'll post a link to it when I interviewed you when you came out with your book, Gut Feelings, which is an excellent book. Excellent book. I highly recommend it. And so in talking about the healing the gut in general, mind body gut connection,
yeah,
that it is critical to supporting the gut mucosa. So I've been looking more for me, as 30 years in practice, histamine issues were very, very rare. And so there's definitely, I'm seeing them more commonly and multifactorial, but it always starts with healing the gut, right? Addressing
yeah,
it. So with testing, some of the testing that I've done is looking at the the um, diamine oxidase
yeah.
marker. And is there any other testing too?
Yeah, no, I like that test. It's a blood test that measures diamine oxidase DAO, which is the enzyme that breaks down histamine. And you can also measure on that same test high serum blood histamines, and you can look at the ratio between diamine oxidase and histamines. So yeah, that's a helpful test that looks, okay, is the body accumulating excess histamines and or is it not producing enough of the enzyme that breaks it down, i.e. an accumulation of this normal mediator, this signaling molecule of histamine. So it is, yeah, it's a helpful test. But again, I knowing it's histamine intolerance is a piece of the puzzle is certainly important. It can give people a lot of peace to know, okay, that's why I feel the way that they do. And A, from a clinical standpoint, confirms this is what's going on here. But I'm more interested in what's driving it. Like what's upstream to that histamine intolerance, and looking at environmental toxins, looking at biotoxins like mold, looking at viruses, looking at something I didn't talk about. All those things that I mentioned are all physiological drivers of it. But another area that we see a lot of times is people that have higher ACE scores, adverse childhood experiences, people that have really going through chronic stress, dealing with unresolved trauma and chronic stress. Certainly, I've seen it until we deal with that piece, the immune system can't calm down. So as you mentioned, it's definitely multifactorial. It's not just one thing. It certainly isn't going to be one thing for everybody. But these are the components that need to be taken into consideration, and the health history would determine, okay, what areas need to be given the attention that it needs. But once you determine the cause, then you would address that cause. So that protocol is going to look different depending on what is causing that histamine intolerance, that dysregulation of the body. But some mast cell stabilizers that I like to just deal with the downstream histamine overflow would be things like higher dose quercetin, the flavonoid, vitamin C to tolerance, of course, is another mast cell stabilizer. I like supplementing with diamine oxidase or DAO. All of those things are good while you're dealing with the
Yeah.
upstream. They're not like the end all be all, but they are good, like quote unquote natural antihistamines or mast cell stabilizers that can be helpful. Other like herbs like stinging nettle can be helpful in this area as well. But certainly the gut's such a significant component because it's, as you know, 75% of the immune system. So to deal with an immune mediated issue, which histamine intolerance is in part that, you get a lot of significant needle moving power by going to a bigger component of what's driving some of this dysregulation. So it's not a magic cure all by improving gut health. Certainly it's not for everybody, but it is to use that bucket analogy, like everybody has their different bucket sizes. That's your bio individual genetic variants like HLA gene variants, which can play a role, methylation gene variants, detox gene variants. The more genetic SNPs that you have is going to proverbially decrease that bucket size.
Right.
But you can't change that bucket size, but you can change what you put in that bucket. So healing the guts, it's typically a bigger component of what's contributing to that bucket overflow or that tipping point of when symptoms or flare-ups ensue. So and all those other things that I mentioned are other ingredients that could be in that bucket, and those ingredients are going to vary from person to person. So those are some. That's like my perspective on these cases.
Yeah, I love it. I wanna go through the supplements again. So
Yeah.
quercetin
Yeah.
and vitamin C to tolerance. In other words, like, keep going up until you get diarrhea and then back down a little bit. Is that what you mean with when you say
Yeah,
vitamin C
yeah,
to
right.
tolerance?
Exactly. To digestive tolerance is mainly what I'm talking about. And then also like the quality of the vitamin C too. Like it's finding a vitamin C that works for that person. But I am a fan of even uh whole food based vitamin C supplements, right? Like camo I like a lot. Other like vitamin C rich plant extracts that can be standardized in supplement form. I've seen good success with. But yes, certainly if it's causing looser stools for somebody that already has IBS-D, as I mentioned, I do see more of these kind of IBS type cases with histamine intolerance. So you don't want to
Yes.
be taking a supplement that's contributing to even more irritable bowel syndrome. So you definitely have to be judicious with not just vitamin C, but anything that could be stimulative to the gut.
Yeah, and a histamine, a DAO supplement, a DAO
Yeah.
supplement and get it under control and have it there for availability. Anything else around histamine intolerance that, we should
Yeah.
cover?
Well, look, I think my advice for people here, it's gonna be multi-pronged, right? As we said, the causes are multifaceted. If we hang our hat on just like one thing, like if you're expecting this one thing to do it, it's not always gonna work out. Some people can get lucky, and that's gonna be the case. But I would deal, and that's why I called that last book you talked about gut feelings. It's dealing with both the gut and the feelings. the physical and the mental, emotional, spiritual. We have to have a both and, not either or approach. So everything we can do to empty that bucket is how we're going to see the a great clinical outcomes, or just great outcomes in decreasing this and reversing this and healing from this. But we have to let the body know, once we've dealt with the threat, where the threat could be mold, for some people it could be other factors. Let's just say we've addressed that, we've retested labs, the mold is cleared out, the gut looks healthier, the environmental toxins are cleared out. But then 9 times out of 10, the person's doing a lot better. They're either entirely reversed, or they at least have significant improvements in severity and frequency of their symptoms. But let's just talk about the more complex cases. Sometimes we see people, and I'm sure you see this too, where it's like they're a lot better than they were, but they're not where they need to be. So they're kind of stuck in spinning their wheels. That's where we really have to dig deeper in dealing with the nervous system regulation practices. And those people typically aren't being as consistent with things like breath work and meditation. We recommend something called FSM, which is a frequency specific microcurrent. Somatic practices, EMDR can be very helpful in this case, like to basically allow to prompt the body to know that it's safe. It doesn't have to be in that hypervigilant defense mode. So I find that these sort of mind-body practices done consistently can be definitely a very unique, specific tool that I see helpful for histamine intolerance and the larger, spectrum of things like POTS and mast cell activation.
And I think it's a perfect segue into talking about, um, your burnout versus you're not lazy, you're burnout, because this is what you're talking about is in that adverse childhood experiences when you've had chronic disease, chronic illness, it's cortisol versus oxytocin. So it's cortisol versus oxytocin, cortisol, most acidifying hormone in our body, and it creates those leaky membranes and impairs healing in so many instances. I mean, it can be a contributor over the long term. So we see that in PTSD, people with adverse childhood experiences or higher number of ACEs. And then where oxytocin, the practices, you talk about engaging the parasympathetic, stimulating the parasympathetic breath work, gratitude and meditation practices, increasing oxytocin, which is very healing. So I'd love to get your point of view on that too.
Yeah. Well, I wrote that post after a day of seeing what I see new telehealth patients go through this a lot, and hearing stories of people going through so much medical gaslighting, and they're meant to feel like they're crazy or lazy or hypochondriac or whatever, just getting older. You've heard probably so much, or just being dramatic. And even their family members that probably mean well, but they just don't know, and they just feel like they're lazy, right? Why are you having this fatigue? Just pick yourself up by the bootstraps and keep on going. Or you're being dramatic, like these symptoms aren't that bad. And I just wanted to be clear of what burnout is,
Yeah.
of that dysregulation of that neuroimmunoendocrine axis that I talked about earlier. And for some people that shows up like an X accumulation of histamines. And for some people, yes, that's a component of it, but they're not having a lot of those overt histamine type symptoms, but they're having fatigue, they're having the anxiety part, they're having the, wired and tired, anxious and exhausted part. And to just give people grace to know that just because something's there every day doesn't mean they necessarily need to settle for it. And it's not like their like lack of willpower, or they're just a weak, broken human being. These symptoms are nudges that the body's giving them, that these are areas that need attention and healing. So yeah, it's something that's near and dear to me, because I see how much people are left to fend for themselves,
Mhm.
and they don't have any clear answers as to why they feel the way that they do. They think it's something, like they make it into their personality, right? Some people have had these issues for years, and they think, yeah, I'm just I just have brain fog, like it's just who I am, or I just have anxiety and depression. It's who I am. It's the quote unquote chemical imbalance, and they make it into their personality. If you can reverse it, if you can heal it and optimize it, it's not your personality. And people oftentimes have dealt with these issues for so long that they have made it themselves, but it's really not. It's a dysregulated nervous system, dysregulated immune system, dysregulated endocrine system is not a personality.
I think that's a powerful statement. So when you're talking about dysregulated nervous system, can you explain that a little bit more?
Yeah. So, I mean, as you know, the gut and brain are formed from the same fetal tissue. They're linked through the gut-brain axis. So the
Well,
what
first of
I
all, that's so beautiful, right? That's so cool. As an obstetrician, just like,
yeah,
the evolution, the unfurling of the fetus, the creation of the fetus and the development of the fetus is
yeah,
pretty powerful, but that literally the gut brain
yeah. It's
connection.
so beautiful, right? And you think of the vagus nerve, that largest cranial nerve, it comes from the root word, which translates to wondering, and it's this wandering long nerve when I say nervous system dysregulation, there's two main aspects of the nervous system is the parasympathetic, the resting, digesting, sort of the grounded, calming state. And then the sympathetic is the fight or flight, freeze, fawn. Now, sympathetic people can think, well, fight or flight, that's not good. That's bad. Well, it's not bad or good. It's just there are two aspects that they both need to be properly modulating and healthy. And most people, it's like a seesaw that's out of balance. Their sympathetic tone is overactive. Their fight or flight hypervigilance is overactive, and that resting, digesting, that parasympathetic is underactive. So nervous system dysregulation, in simple terms, is that's what's really going on. There's an overactivation of one aspect of the nervous system and an underactivation of another aspect. So a lot of what our job is in functional medicine is in supporting that parasympathetic for most people because it's so underactive. And part of that is centered around improving vagal tone or improving the strength, innervation of that largest cranial nerve that's responsible for the aspect of the autonomic nervous system. Um, so yeah, it's definitely important. It's definitely important. And burnout is without a doubt, that's a central component to people that burnout. Can you find someone with burnout and this nervous system dysregulation spectrum, let's just call it that doesn't have poor vagal tone? It's going to at least be a piece of the puzzle for nearly everybody. I can't think of an exception to that. I'm sure there is, but it's at least a piece of the puzzle for these people.
What are some practices that you recommend or see the best results with to stimulate vagal tone?
Well, the simple things for vagal tone for most people. Now, look, this is a spectrum. So I don't want to. There's some more significant cases, and then there's the mild to moderate cases. The mild to moderate, and certainly they should be a part of the severe, more complex cases, but they're not going to be the only tools within the toolbox. The more complex the cases are, but the basic foundational tools are, I call them metaphysical meals. Like we focus on clinical nutrition, of course, nutrient density, bioavailability, all these things are important, supporting gut health through food. But it is, that's important, but it's just, and I would say this, improving gut health does improve vagal tone. The more you can lower inflammation and support the gut through the vagus nerve, that support vagal nerve health through gut health, it's important. But it is not everything. Like, what are we serving our head and our heart on a daily basis? As much as you get your nutrition down right, you have to look at these things that aren't food, but they are their information for our biochemistry. So, but they're a lot more nebulous because it's a lot more linear and straightforward for us to say, okay, looking at macros and vitamins and nutrient density, all that stuff, and be prescriptive with it. But it's a lot more, all right, abstract to talk about things like chronic stress and unresolved trauma, but prescribing, if you will, these things like you would breakfast, lunch, and dinner, or an exercise, right? They are practices. But things like breath work, we see a lot of good success with consistent breath work practices. And that could be mild, like more beginner, like box breathing, where you're just holding your breath and letting your breath out and kind of having this sort of proverbial box to be meditating on or seeing it as a, symbolically. We see a
That's
lot.
kind of like the in for 4, hold
Yeah,
for 4, out for 4, hold for
exactly.
4. Yeah. Okay.
Exactly. Hold, breathing in, hold, breathing out, hold. So that's box breathing. Two more advanced holotropic breath work, which is actually very similar to, and the research is the origins are the same as psychedelics. Kind of getting these sort of psychedelic state through breath, just endogenous breath work, stimulating these states to metabolize stored trauma in the body. So we see good success with breath work and meditation being a part of that too. And grounding practices, getting out in nature, certainly can be a significant needle mover here. EMDR, eye movement desensitization and
I
reprocessing, a type
love
of
that.
therapy, where I see great success with improving vagal tone. And all this is so applicable. I'm glad you asked me about these two things, because all of these things are so applicable to the mast cell activation, histamine intolerant, and the burnout, which there's such an overlap, right? People that have histamine intolerance, burnout's a part of that, right? Because it's dysregulating of the neuroendocrine axis. The So there's some practices, and I like some of the wearable. What I typically will tell a patient is find something in your toolbox, and we'll help you find it. But we need to find something active and something passive to be supportive of vagal tone. So something active is something that you have to show up for and put the time and consistency in. And I don't mean put it in the time to be stressed about it, but just being diligent with the practice. So it could be breath work, be meditation, somatic practice, just like basically movement practice, body movement practice to clear stored trauma and stress. But then something passive, I like because it's not something you have to add to your to-do list, but it's something that's supportive in the background of these pathways that we want to be supportive, in this case, the vagus nerve. So I like there's different, like the Apollo Neuro, if you're aware of that, it's out of the University of Pittsburgh's psychiatry department, I believe. But it's like basically wear on your wrist or your ankle, and it's a vagal nerve stimulation. And there's one called Sensate that we have a lot of success with as well. There's a few other ones that are either some sort of wearable device that work on frequencies that are supportive of vagal tone. So I like that, because for someone that's already stressed and not feeling so well, it's something that could really be a needle mover, because it's just they don't even have to think about it. It's just doing the job for them. And these things are typically connected to an app and doing the work that way.
Yeah, and I think one that's coming out in January, hopefully sooner, but it's the Gem Band.
Oh,
So
cool.
it's reading based on the over 30 pulse measurements, like based on TCM on traditional Chinese medicine, and also has the digital information in it. So I'm excited about that. That one's by Nest Health. So we'll see.
Wonderful.
Okay. And I wanted to ask you with that breath works, like if I'm going to choose time, take time to do that breath work, I want to be the most efficient. And I know you're going to say, well, it's just going to be the one that works best for you. But with that said, like, okay, the Joe Dispenza breath, the Wim Hof breath, is there another breath?
Yeah.
You
No,
need to do a video for me on
I
this.
know. That's what I need to do. I need to do. No, it's I yeah, you knew my answer. The answer is the one that you have to meet your. Here's some pro tips. Number one breathwork pro tip: if you've never done this before, start off low and slow. Start off with the box breathing. Box breathing is a wonderful tool. It's accessible. It's not overwhelming. I teach about how to do it in my book. You can read Gut Feelings to learn some simple breath work. And then I do talk about more advanced holotropic breath work in there too, but the practices are in there. So start off low and slow, meet your body where it's at. If you've never done it before, look, these more advanced breath work can be very, it can start to stir things up. It could be kind of a very visceral somatic experience. So sometimes it requires a facilitator. If you have access to a breathwork class or even an online community, it really can be helpful to have a teacher involved in this, because it can definitely, but you're clearing stored trauma many times in these instances with these more advanced breath work. But I would say my overall opinion on this is the right type of breath work or the right type of meditation for you is the one that you can stay consistent with, that is conducive and congruent to your healing. So sometimes people like to stick, they read about it, they heard about it on a podcast, and it's like pushing a square peg through a round hole where it's just not where they're at. So I think that's not very helpful, because we want these things to be supportive of the parasympathetic. Remember, that's why we're doing it. So sometimes it could be a good thing in theory, but not right for you. Back to that sort of bio-individuality that we talk a lot, functional medicine. So it's finding the right one that works for you, that you can stay consistent with. Because if it's a source of stress or anxiety or overwhelm, or it's just this arduous like pain point, that's the antithesis of why we're even doing this. So that would be some words of insight that I would have for anybody.
And another way to monitor is the heart rate variability, right? Is
Yes,
it
HR,
improving our heart rate variability?
absolutely. And you can track HRV we track it on Whoop or a lot of these wearables that
Oh, don't
measure
have it.
sleep. You can see HRV improve through this, because HRV, improved heart rate variability, is a sign that the parasympathetic is being strengthened.
I think that's so important to exercise the parasympathetic, and what gets measured gets managed. So improving
Yeah.
that heart rate variability. And if we're doing things and we're not improving it, continuing to look at the underlying reasons.
Yeah.
And it's powerful. So in working, a couple things, one of the thoughts that came up with histamine intolerance and thinking of the benefits of cold plunging in general, but would that be a good intervention for people with histamine intolerance, or you have to be so
Yeah.
careful with the immune system?
Yeah. Look, my advice would be, I don't see it as being a non-negotiable. It's not mean I don't see it as part of everybody's protocol,
Yeah.
but I do think it can be helpful in some ways, because it is helping to strengthen the nervous system. It's helping to lower inflammation levels. I will say this: the hallmark. I'm thinking of cases that I see like the biggest that benefit from cold plunge the most. It's for the people that have the brain fog and the fatigue. But you want to be mindful of, yeah, it's a hormetic effect in the body. You're not just stressing the body out for the sake of it. So start off low and slow as far as time and temperature. Well, low and slow. I mean, temperature can be higher, time can be lower. Low and slow doesn't work there when you talk about temperature. But yeah, so temperature can be higher, like even in the 50s, even in the 60s. I mean, really you can be
Even a
very,
cold shower at the end,
yeah,
turning your water to
exactly.
cold. Yeah.
Be gentle with yourself, and then maybe work up the time and or decrease the temperature over time. But check in with your body, be intuitive with it, because again, going back to that sort of, I heard it on a podcast, they try to like rush and do too much too soon, and there's a balancing act. Yeah, I had a patient the other week tell me like she did so well. We were titrating. This is a cold plunge. She was titrating so good with decreasing temperature, increasing time, and kept seeing more and more wins. Increased focus, better mood, less inflammation, better sleep. Great stuff. She got she was feeling so good. She wanted to see how far can they go. So then she like jumped so much. Like and she like what she did is she got oh, I can laugh in hindsight. She got a no, this is what she did. She kept her nose out of the water, and she was just stuck her whole head in, because she was having a lot of neurological symptoms like brain fog, fatigue, anxiety, depression. So she's like, okay, I'm gonna stick my whole head in and keep my head submerged in the cold water the entire time, which certainly can help some people. It is certainly a more advanced approach. But my point is, she just like rushed, and more isn't always better. And she had a flare up of symptoms from that. So you can see
Ah,
the
that's a shame.
balance that for weeks she was doing great with a sort of judicious, consistent use. But it's human nature, right? If we, especially when you don't feel good and you start feeling better, it's very easy to be like, all right, I'm going to double down on this, and you get diminishing returns oftentimes if you just push it too much.
Yeah, so it's really working with a good practice, a good clinic, learning about this. And your clinic is you have telemedicine too, right?
Yeah,
Well, can
yeah,
you
well, we
tell?
do. Yeah, thank you. Yeah, we've been doing telehealth. I started the first functional medicine telehealth clinic over 15 years ago. So I've been doing telehealth my entire career. It was not some, I did not see the future. I didn't know a pandemic would happen in 2000 and whatever year it was. But we didn't even have a language 15 years ago for telehealth. We called it a virtual functional medicine clinic because that was the best I could come up with. And then over the years, it was like, all right, yeah, telehealth's a thing. And that's what we've been doing. So it was just because I lived in the middle of the woods, in the middle of nowhere, and lots of people weren't where we were. So we had to figure out, okay, how could we 15 years ago get labs to them and figure all this stuff? So yes, that's my day job, and this is what we just live and breathe and really immerse ourselves in, these cases of hormone imbalances and metabolic issues, autoimmune problems, gut health issues, and looking at labs and getting those labs looking great. And those labs are the keys and the pieces of the puzzle of why people are going through these health issues. So yeah, I love
You're
what I do.
talking when you say labs, those specialty labs depending on the symptoms. So like mold
Yeah.
testing and Nutri-Eval or total toxic burden testing and Dutch test or urinary hormone
Yeah.
metabolite testing and
Yeah.
all of those.
And I absolutely. Yeah. And I want to thank you like for on the clinical level, like meeting, like getting, working with my team on female hormone side of the clinical side of things. And for everybody that's listening to this, Dr. Cabeca was on my team meetings. We're just giving my team some clinical pearls, and we appreciate that immensely. Thank you.
Oh, you have a great team. You've cultivated a great community and, we love you. We all love you here too. And so tell them how they can find you well and definitely follow his Instagram and social and listen to his podcast. It's an excellent podcast and I love the way you communicate and share this
Thank you.
information too.
It's called The Art of Being Well, my podcast. That yeah, everything's at drwillcole.com. There's drwillcole.com. Yeah, everything's there. There's lots of free content, and the patient telehealth stuff's there too.
So excellent. Thank you so much for being on the show today. This was a lot of information we're talking about. I know like my mind was going into a lot of scenarios, and I think emphasizing the fact that whatever like don't settle, right? Like I don't want anyone listening to settle for, "Oh, I just have to power through, or this is, I've been dealing with this, or if it's the histamines, I have to live on antihistamines. Getting to the root cause and healing those issues is powerful. And Dr. Will Cole's book, Gut Feelings, is an excellent book to read on that, as well as the inflammation spectrum too. I mean, your book also, you have the book Ketotarian. And so those are excellent resources to get started, to get help if, you know,
Thank you.
don't give up, right?
That's right. Don't give up. Advocate for yourself.
Yeah. Thank you all for being here. Thank you, Will.
Thanks for watching another episode of the Girlfriend Doctor podcast. Check out all the links below for more.